required. Now next I'll request Dr. Purvi Bhagat, who is going to talk to us about drug interactions.
Good afternoon, everybody. I'll be talking on drug interactions and side effects of the anti-glaucoma drugs. No financial interests to be disclosed with respect to this presentation. So when we talk about side effects, basically what we know as drug reactions, or what is popularly known as adverse drug reactions, or ADRs, there are three main culprits. One can be the active ingredient or the drug itself, or it could be the preservative. Most of the drugs which are now notorious for side effects are because of the benzalkonium chloride, or it could be the overall composition, more significantly the pH of the drug. There are four types of reactions that can happen. One is the ocular ADRs in response to topical ocular drugs, which are usually very easy to recognize. Or it could be a systemic ADR in response to a topical ocular drug, mainly because of the systemic absorption through the nasal mucosa. Third, it could be a systemic ADR in response to a systemic drug. Again, these are usually easy to recognize. The fourth category is a little difficult to diagnose, and for this you need a complete medical history and knowledge of the pharmacokinetics and pharmacology of the drug. That is the ocular ADRs which respond to a systemic drug. Here these drugs are not basically anti-glaucoma drugs, but they can often mess with your diagnosis of glaucoma, the management, and they can actually cause glaucoma. So these are the different types of side effects that we see. A very common periocular pigmentation that we see with PG analogs, and you can understand the concern it may cause, especially if it is a unilateral, if it is in females or young individuals. A characteristic allergic conjunctivitis which happens with brimonidine, it can happen at any point of time within 1 week of starting the treatment, or even after a year. The patients will come with complaints of itching and foreign body sensation, and you should never fail to evert the lead, and you will see this characteristic allergic conjunctivitis. Again, a significant hyperemia. Earlier it used to be caused by the bimetoprost higher concentration, and now it is so very commonly seen with the Rho kinase inhibitors. A periocular dermatitis, again notoriously caused by brimonidine, but can also be caused by the topical CAIs. Another case of polypharmacy, you can see the significant amount of periocular pigmentation and the dermatitis and lid thickening and edema that is there. Subconjunctival hemorrhages, which are not uncommon with the Rho kinase inhibitors, and the very popular reticular honeycomb type of a corneal edema which is there with nitarsodil. And the patients will come to you with a decrease in vision, and you can just check when you see this type of an edema that the patient would definitely be on nitarsodil. Again, these are cases of advanced dermatitis. You can see the because of the constant rubbing that happens, the itching, the watering, the patients keep on rubbing their lower lids, because of which the punctal eversion and even a medial ectropion has started. Another case of punctal eversion, and you can see the lower lid edema which is there because of brimonidine, and on omission of the drug you can see how that entire side effect has reversed. Another case, this was just last week we encountered, this is erythema multiforme minor, which is because of use of acetazolamide. The major form, what we popularly know as the SJ syndrome. So this is in response to acetazolamide. There is an endless list of drug interactions and side effects which happen with the anti-glaucoma drug, and none of the anti-glaucoma drugs, unfortunately, is totally free from side effects. The PG analogs, apart from the topical effects, they can cause headache or flu-like symptoms. Timolol, of course, we know its effect on the respiratory system, on the cardiac system. It can mask the effects of hypoglycemia and brittle diabetes. It can cause hyperlipidemia and fatigue. Brimonidine, it causes CNS depression and even mood changes, because of which sometimes the patients can undergo unnecessary psychiatric and neurological investigations and MRI and whatnot. But all we actually just need to do is be aware and omit the drug. And if a patient is sensitive to brimonidine, it often predisposes to allergy from other drugs. Topical CAIs and acetazolamide, we know about the SJ syndrome. And pilocarpine, systemically, it can cause abdominal cramps, which in acute angle closure glaucoma can sometimes mimic acute abdomen because of the cramps and nausea and vomiting that the patient has. And glycerol and mannitol, of course, we know glycerol can cause nausea, vomiting. Mannitol can have effects on the respiratory system, on the CNS, on the cardiac system, and on the renal system, especially in compromised patients. The tolerability of drugs overall decreases with increasing age of the patient. More the number of drugs and more the number of bottles the patient is using, more the duration of therapy, and with the presence of benzalkonium chloride in the composition. These are again cases of significant BAK sensitivity. Both these cases, you can see the significant amount of edema and periocular dermatitis that is there. No matter what the patient used to instill, the dermatitis would just be there or it would keep on increasing. And what we ultimately figured out, it was not the drugs which were causing the reaction, it was BAK. And simply on the omission of BAK containing drugs and transferring the regime to preservative-free formulations, you can see the recovery the patients have had. At our college, we have the Pharmacovigilance Program of India Nodal Center. So they encourage all the departments to report the ADRs to them. So this is an evaluation of 2023 of the ophthalmic ADRs. So out of the total 2,049 ADRs that were reported to the Nodal Center, 59 were from ophthalmology. And of course, 59 are the reported. There would be more which were unreported. Males more commonly affected, elderly is more commonly affected. Presentation very variable. The most common ADR was redness, itching, and allergic dermatitis. And the commonest ophthalmic drug group which was involved was anti-glaucoma drugs. And of these, brimonidine being the most notorious, followed by the topical CIs, netarsodil, and then timolol. So what is the impact of all these side effects and reactions? Most of them are innocuous and reversible after omission, but sometimes fatal ADRs like the HD syndrome, sometimes status asthmaticus from timolol have also been reported. But from all those images, we can figure out that even a smallest amount of impairment can have a substantial impact on the patient's quality of life. It is the most common reason for non-compliance, and any effect on the ocular surface is likely to affect the outcomes of the surgery also in these cases. So it is very, very important to early detect these ADRs, be aware of what ADR can happen, not to ignore the symptoms and signs, and keep our focus beyond glaucoma and beyond the IOP and DIS also on all the symptoms. Immediate withdrawal of the offending agent is necessary, and a prompt clinical management to treat the ADR and to prevent complications is necessary. Beyond that, it is also important to report these ADRs, not only to the pharmacovigilance department. They have their own portal where you can report all these ADRs, but also our own AIS has an adverse event reporting committee, wherein any unusual, unknown, or clusters of ADRs, if you see, you can report to them. So at the end, it is important to recognize the side effects, investigate them, withdraw the drug, act on it, report it, and most importantly, prevent the recurrence. Thank you.
Thank you, Purvi, for a very nice presentation and showing all your own pictures in a very pictorial way. People will